Thank you for joining us on Journey to 600. Today we're going to be focusing on other systems, specifically lymphedema. First, there's primary lymphedema, which is caused by an inherited or congenital condition. Examples include Milroy disease and lymphatic hypoplasia. Then we have secondary, which is caused by trauma. This is common with cancer treatments, wound or skin infections, filariasis, which is the most common, obesity, cellulitis, and chronic venous insufficiency. Lymphedema does have stages. So, stage 0 is when a patient is subjectively saying that their limb is heavy, but there's no visible swelling or pitting. Stage 1 is considered reversible lymphedema. It has noticeable swelling with pitting edema, but it can be reduced with limb elevation. Stage 2 is considered irreversible lymphedema. It has visible swelling and non-pitting edema and doesn't respond to elevation. Your patient will have a positive Stimmer sign. It is also common for patients to have lymphostatic fibrosis and tissue proliferation. Stage 3 is when you begin to see skin changes and possibly elephantitis. Here I just wanted to provide a visual of the stages of lymphedema. I'm more of a visual person, so this definitely helped me remember it. I've also included a visual of a negative and positive Stimmer sign. So a negative sign is when you are able to pinch or lift the skin of the second toe. And a positive sign is when you are unable to pinch or lift the skin of the second toe. And that's most commonly seen during stage 2. Then we have treatments and precautions. So, some precautions first: don't walk barefoot, no blood pressure readings on affected limb, and avoid injuries to skin, tight clothes, and heat, such as hot showers and heating packs. And then when it comes to treatments, you want to use superficial massage on the proximal segments first and then on distal segments. I know we're used to, pushing the fluid back up to the heart. You still technically do that, but you want to work on your proximal. So you want to work on the abdomen and the groin area and their chest, and then go more distal, like with their arm and with their leg and things like that. So that bit can be confusing. So you work proximal to distal, but you're massaging distal to proximal once you get to the distal bits. When you Google, you'll notice that there's many different techniques and approaches to manual lymphedema drainage. So when you Google, you'll find a bunch of different things, but I feel like the big points to remember is that you work proximal to distal. Next, we have long stretch bandages and short stretch bandages. If there's one thing I've learned, the long stretch bandage provides high resting pressure and low working pressure, which is not what we want. That is commonly used for athletic sprains and things like that, while short stretch bandages provide low pressure at rest and high working pressure. So, this is most commonly used for people with lymphedema, and especially when they're exercising, because it has that high working pressure. I'm going to include videos and websites below on all of this stuff, and please feel free to reach out if you have any questions on anything I said. And of course, use other resources, Google other things. It's important to kind of just have a good base knowledge on this, because this isn't making up a big part of your test, but I feel like if you know the basics, it's going to help you get those one or two questions you might have on lymphedema. Here I've just provided another visual on grading your patient's pitting edema. So pause this, take your time, and figure out a way that you can memorize this best. Okay, the correct answer is A. So let's go over this question. Your patient reports that they are feeling like their right lower extremity feels heavy, but during the evaluation, you note that there is no signs of swelling or pitting. What would you stage this on the lymphedema scale? Okay, I'm going to give you a quick overview of the stages of lymphedema. So, stage 0 is when a patient objectively reports that their limb is heavy, but there's no swelling or pitting. Stage 1 is when there's reversible lymphedema. So, swelling and pitting is noticeable, but it can be reduced with elevation. Stage 2 is irreversible lymphedema that has visible swelling and non pitting edema, but these don't respond or decrease with elevation. They would also have a positive Stimmer sign. And stage 3 is commonly elephantitis. Okay, the correct answer is C. Let's go over this. While testing for grading of pitting edema, you find that your finger goes about 5 millimeters deep into the lower leg. What grade is that? Well, referring back to my visual that I provided, you need to come up with whatever way you can memorize these numbers. I have no new knowledge to lay on you. That one is straight memorization. Okay, the correct answer is C. At what stage of lymphedema does the Stimmer sign become positive? Well, we have already gone over staging twice in this lesson. So if you're still missing this question, write it down, make a chart, help do something to help you remember these stages. There are keywords that go with each stage, and I'm going to go over them really quickly. Just third time's the charm. Stage 0, you're going to have subjective heaviness and no visible swelling or pitting edema. Stage 1, it's going to be reversible. You're going to see swelling and you're going to see pitting edema, but it's going to decrease with elevation. Stage 2, you're going to have a positive Stimmer sign. You're going to have swelling and non-pitting edema that's not going to be reversible with elevation. That's why it's considered non-reversible lymphedema. And then stage 3, keyword, skin changes and elephantitis. The correct answer is A. Which of the following correctly describes a short stretch bandage? Well, the one thing we know about short stretch bandages is that they have a high working pressure and a low resting pressure. So this should automatically help you mark out B and D. So now you're trying to decide between A and C. You've got a 50-50 chance. I didn't directly go over this, but a short stretch bandage could only stretch up to 20 to 40% of its original length, while a long stretch could stretch up to 140% of its original length. I'm going to be posting videos on short stretch bandage in the description box, so please check those out, utilize other resources, and do your own research on this topic. Thank you again for joining us on Journey to 600. Please like, subscribe, and turn on your notifications so you know when we post another video. Thanks.